Mhm. Hi everyone, my name is Alyssa Krug and I'm the president of AMCP. We're really excited for you to get to know what AMCP does and what managed care pharmacy is all about. Our membership chair, April, put together a little presentation for you guys to watch. Hope you enjoy it.
Now I'm going to go through a short presentation for you guys so you can get a better idea of what exactly AMCP is. Things off, I thought I would introduce you to our mission. So, the mission of the AMCP is to improve patient health by ensuring access to high quality, cost effective medications and other therapies. As you go through this first year of pharmacy school, you're going to learn how important this really is when it comes to managing patients. Now you're probably thinking, oh, that sounds so great. Let's have like the best therapies possible for patients. But what exactly does it mean to be a managed care pharmacist? What even is managed care pharmacy? That's what I'm here for to tell you. So here's two little definitions of managed care. So one is that managed care is designed to improve the quality and accessibility of healthcare in a cost-effective manner by focusing on managing medication-specific outcomes in a way that drives down the total cost of care and improves the overall well-being of the patient. Another definition is to identify and develop cost-effective initiatives through medication therapy management, or MTM, formulary benefit design, as well as clinical safety and adherence programs. I know these are some kind of big, big worded definitions, but basically what managed care is just to find the best therapy for a patient, not only medication wise and how well it works on the patient, but as well as finding something that's going to be cost effective, whether it's using a medication that has like dual actions and can replace a patient who takes two pills or something like that, or just finding a different alternative medicine that should have the same outcome. Just different ways to make a therapy the best way they can for a patient. Now that you kind of have an understanding of what managed care is, I just wanted to show you this slide that has a lot of information about the different types of pharmacists that use managed care. So as you can see, it's definitely a lot of different areas. So it's very important when going through MTMs or the medication therapy management I mentioned earlier. It's important in creating different medications or looking up information about a certain drug. And it's definitely really important with insurance programs, government programs, as well as some areas of specialty pharmacy. So here are the AMCP chapter goals here specifically at the McWhorter School of Pharmacy. So our goal is to educate students on managed care principles that will benefit them in all areas of pharmacy and to help guide those who are interested in pursuing a career path in managed care pharmacy. So I wanted to include this because managed care isn't just important for those who want to specialize in managed care pharmacy. Managed care is important for all areas, so anybody who wants to become a pharmacist can benefit from learning more about managed care pharmacy. So now you know some more about managed care and managed care pharmacy, but what do you actually do as an AMCP member? So one thing that's really big within AMCP is service. So we have countless fundraisers as well as numerous volunteer opportunities. Two examples of some of our fundraisers we like to do is sell our McWhorter School of Pharmacy mortar and pestle, as well as a family t-shirt, which also features some of the important symbols in Birmingham. As far as volunteer opportunities, we usually have lots of different health screenings, specifically a Shepherd's Fold health screening. And this year we're hoping to be able to have a group together for the End Heroin Birmingham walk. Of course, all of these may be adjusted due to the current pandemic, but we're hoping to be able to have as many opportunities for you guys as we can in a safe manner. We like to have different opportunities for our members to grow in their professionalism. So each month we have chapter meetings, and I've included the dates for those who might want to go ahead and mark that down. We also have different industry committee events for those who are more interested in the industry side of pharmacy and managed care. We also look at opportunities for P&T shadowing to learn more about therapeutics committees. And our big event in the spring is our business etiquette dinner, which is a little 3-course meal with some professors. And you get to learn more about the skills you need for networking and job interviews. And most importantly, this event also counts as portfolio credit. So a big part of AMCP is community. So there are 2 national events this year. The first is AMCP Nexus, which is going to be virtual at the end of October. And then we have AMCP Annual, will be held in mid-April. And hopefully, if things start to calm down with COVID-19, it will be held in San Francisco, California, which is super exciting. Another note I want to give you guys is that when you join AMCP, you really do join a community. So you make these lifelong friendships and people who you might work with when you graduate or get some ideas from, and just people you get to talk to while you're in school. So, as being one of the smaller organizations on campus, I really do believe we are one of the more tight knit groups, and I've always felt very welcomed. So, hopefully, everyone else who joins will kind of have that same experience that I did when I joined. now that you've heard all this information about AMCP, I know you guys must be wondering, how do I become a member of this fantastic organization? Well, I'll tell you. So our dues are $30 a year, and you can make that payment by Venmoing our treasurer at Madison Frazier and include in the subject line AMCP and put your full name so that we can add you to our roster. And if you don't have a Venmo, you can email me at my Stanford email included on the slide, and we can make other arrangements for payments and getting you on our roster.